Hello, everybody. First of all, thanks to Sue. I just can't believe what you managed to organise and get us all together in a room. And that kind of energy and what you do is really, really important, especially as we move towards 2020. So I'm going to ask you, because there's a lot of excitement, just to literally take 10 or 15 seconds and breathe, shut your eyes or otherwise, and think if there's one thing that you really want to happen. We're going to make that happen in 2020, but just think for a minute. What is it that you want to change? Right. So now we have to be the change that we want to be, or whatever that expression is. But I just want us to be really clear, because there is so much happening. So I work at the World Health Organization. I've been there for the last 6.5 years, unbelievably. I always felt I was new. And I spent the previous 32 years in Africa and Asia. So it was a bit of a shock coming to Geneva and seeing how the other half lived and a few other things. It's been great getting to know all of you guys. So I'm just going to give you, very briefly, a flash on and off of that one slide. It must go this way. So a lot has happened in the last few months in midwifery that will have a profound impact on where we go in the future. So I just wanted to spend a bit of time to help us focus on this fantastic research meeting, so you can focus on what it is you think you can contribute and really make happen. So first of all, we live in unprecedented times, and Sue and Sheena's book is phenomenal in that it brings together, we are in this sort of historic moment where we've never before had so much intervention and so much lack of intervention. So we have to look at both all the time. If you'll remember in 2016, the Lancet Maternal Health Series, Too Much Too Soon, Too Little Too Late. In 2018, the Lancet Global Health Commission, shocking results, poor quality of care is now a bigger barrier to reducing mortality than insufficient access to care. We are not doing this right. We are pushing women into facilities and leaving them to be badly treated in a disgusting way and dying. That's not right. We're doing something really badly wrong. So this is what we now have to contend with, and I think those two bits of research. Yes, sure, yeah. yeah. So, these two bits of research have really highlighted, 2 years ago we were not having this discussion. So that's where I just want to start. The World Health Assembly in Geneva, power, big buildings, flag waving, 194 member states, which means the Minister of Health and his teams. These are the people who make the decisions, not WHO, by the way. We're not the organization that makes the decision. Every year they come to Geneva and they tell us what are their health priorities. And they tell us that by putting on the agenda what the most important side events are. So what happened? And why is it important for this? Really importantly, we all know, slightly boring photograph of an absolute eccentric madwoman who changed the world. I love her biographies. Florence. So what did these 194 member states say? They agreed to put nursing and midwifery at the center of achieving universal health coverage. That has never, ever happened before, and it was unanimous. And then they decided that in 2020, it's the year of the nurse and the year of the midwife. That is something that we cannot drop. All right? So that is 194 governments that we now have to respond to in a really big way. Not just little things. If we drop this opportunity in 2020, we've lost it for another 100 years. This next thing, what else happened? This framework for action. I've got a copy in my bag. First time in 72 years at the World Health Assembly, we had a meeting led by governments, by the way. This was not me and Elizabeth. This was government saying this is their top priority, midwifery. And there were only 16 side events. And they chose this one and they got it together. We had the opened by Lord Nigel Crisp. We all know Nigel. Deputy Prime Minister of Nepal, Minister of Health Sweden, Minister of Health, a couple of other countries, Chief of Health Malawi. We had our Government Chief Medical Officer Sally Davis. It was just phenomenal, and we had Carvery Mayrush stole the show by saying what it was really like to be a midwife and why do you want to be a doctor when really being a midwife is the best profession ever. The room just erupted. So you can imagine a normally boring bureaucratic meeting went absolutely AWOL. It was the most fantastic meeting, and even the cleaner said she'd never known anything like it after 7 years. So, you know, we kind of, and it wasn't a bunch of midwives. Sally Pearman was just brilliant. And remind me if there were other people I've forgotten. But I sat there and I just couldn't believe what was happening. And so, you know, and it wasn't a bunch of midwives on the panel. These were ministers saying very, very seriously, this is what they want and this has got to change. Wonderfully, this report was not a WHO report. It was led by WHO because it was a WHO publication, but it was with ICM, and a huge thanks to Frank and Sally. I've never seen the ICM take so much attention. Every single word was edited by ICM. It was fantastic. UNFPA 100% behind, and UNICEF. So during the rest of the assembly, UNICEF kept saying when all these newborn events were going on, but we can't do this without midwifery. I've never heard that language before. So this is really important. And it's all of your research and the work that Sue does coming to WHO on guidelines and other things, and Jane, who I'm going to introduce. It's led by midwives and Billy and the whole collaborating centres that's making this difference. It's really phenomenal. We know this. This came out in the Lancet series, more of that midwifery, when midwives are educated to international standards, and midwifery includes family planning, it can avert more than 80% of maternal deaths, stillbirths, and neonatal deaths. Now, we know that from the Lancet. Travel around the world, people haven't heard of that. When they hear that one thing, that's what turns the head of a minister of finance, a minister of education. We've got to get better at using this fantastic data that you put out. So that was the headline in the report, based on the Lancet series. I'm not going to go through that, but this has been so groundbreaking, and it will continue to be. And I think what's really important, the report was ostensibly about education, but it was really about rethinking midwifery, and rethinking it in a totally new way, because if you look at that poor quality of care, we're not doing things quite right, and starting with education, but everything else that goes with it. So we didn't just do this report. We spent almost 2 years with a series of global consultations. Ethel's there, Carvery's here, Billy's there. A lot of people, Sue, were involved in all these consultations. And I was blown away by what these consultations came out with. It was more than I hoped for. 3 things. Every woman and newborn to be cared for, not just by a midwife, but a midwife educated to international standards. How hard have we tried to get that out there? And the title midwife should only be used for providers who are educated to international standards. That's very few countries at the moment. So what does that mean for skilled birth attendants? Are we really changing our global language? This is huge just in itself. So we have to really carefully think. That's a global consensus. It's been agreed by all those agencies and it's been launched. We have to live by that now and use that language. Secondly, strengthen midwifery leadership. Now, in this room, I don't think there is a government chief nursing midwifery officer. How many of you have a government chief nursing midwifery officer or work with one every day? How much of you involve in your research, in your funding, in your media, in your advocacy? We're leaving out our precious resource who are very disempowered. But start with them and get this leadership right. It's coming. It's really coming. But just that in itself was a big statement. And then improve coordination. The fact that UNICEF, UNFPA, and WHO, 3 UN agencies, did not compete over this report, but collaborated over it, is really good news. And in countries, we have got to work together, bring our budgets together, work together, and speak with one voice, with all of you and the research community. So I was just really amazed that this is what the consultation came out with. I'm just going to keep moving. I'm not going to go into this in detail now. At lunchtime, we can go in more detail, but this is about education. And for years, having worked, going right back to Bangladesh in 1984, it was always, can you give me a curriculum and a flip chart? And this was take a different view. Start with your leadership and policy. Get your data and evidence. Build public engagement. Talk to media, parliamentarians, the obstetricians. Build up your momentum. Then prepare your educational institutes. By the way, 40% have no toilets and no water, and we're teaching midwives in disgusting, unsafe conditions. Get your practice settings and your clinical mentors sorted. Then start to strengthen your faculty. Nepal identified 3 universities, and it's going to spend 3 years on that. And then get to your standards and then your curricula. Then you can start to teach. And most importantly, we have been really poor at monitoring and evaluation. We've got much better at the research thanks to people in this room, but we're not good at monitoring and evaluation and saying, as we discussed and Alison McFarlane raised yesterday, what are our indicators for midwifery? How do we know whether we've invested in a good programme? So I won't spend too long on that. So what did we do at the Assembly after that? We had a meeting with fantastic government chief nursing midwifery officers. They are ready to move if we are behind them. We met with about 30 of them. 3 things came out. We've got to implement that 7-step plan. A very interesting comment from the Swedish in that meeting. Your advocacy is lovely. You tweet, you talk to each other. HIV didn't get where it is now, and they didn't build UNAIDS by that. We have got to get serious about the impact of our research and what it means for women and newborns. And I don't know how we do that. I'm looking to all of you. But we've really got to get serious on that. That takes money. And the most fantastic thing is, for many years, I think nearly all of us have wanted to get a really good economic investment case on why midwifery is such good value for money from a human rights perspective, from a women and newborns and families perspective, and from the midwife perspective. We're going to now move ahead on that and get a bunch of economists and midwives together, researchers. So then we went to the Midwifery Symposium. It's been a bit of a what do I call it, Frank, a non-stop flight thing at the moment. I love this photo, by the way. This is Bangladesh, and I think about 2 years ago, you would never have seen a midwife with a woman, a companion at birth, and her standing up in a clean hospital. That was never, I mean, what incredible work you and FPA have done in Bangladesh. So we talked about midwife-led continuity of care, which Jane is going to talk to and update us on. We're all over the place on that. It means different things to all of us in this room, but when you open it up globally, it means different things. Interprofessional team working. ICM did a fabulous session. We've got to work with obstetricians and paediatricians and anaesthetists. We can't sort of be isolated. It's about the woman and the newborn and all that. We've got to work more in partnership. We had a joint global statement on all of that. I haven't got that with me. And then we talked about the next 3rd State of the World's Midwifery report. That will be delayed till 2021. Originally, it was going to be launched in 2020. And that's because we want to do more detail. We want to go further into the economic analysis and other things. And I think we're very happy with that. And then, I'm not going to run through all this, but where are we now on the evidence? Sue has contributed hugely to the WHO recommendations. And we are now updating after the intrapartum, we're now updating the postnatal care. But I just want everyone to know this is in the WHO recommendations. It comes from work done by Jane, Sue, and others, but that a midwife-led continuity of care models in which a known midwife or small group of known midwives supports a woman through antenatal, intrapartum, and postnatal are recommended, these models, in well-functioning midwifery programs. Try and translate that into Guinea-Bissau. Okay, so, we have a lot of work to do. But it's the most important recommendation for midwife, I think, that's ever come out for midwifery, that's come out of WHO. Jane is going to talk about this, which is the midwife-led continuity of care. But if I just show you this one arrow going to 24% less likely to experience preterm birth if a woman has midwife-led continuity of care. If the vaccination team in WHO UNICEF had come up with a vaccine that prevented preterm birth by 24%, I can promise you everybody would invest in it. What is happening that this has come out, and I haven't heard a pipsqueak from a donor about this yet. We still have work, it's extraordinary, but we've got to get better at articulating actually what this means and how to do it. So that's why I put that up, not because I don't really know, because Jane's going to talk now. Then there was Women Deliver, just immediately after the symposium. And the reason I've put this up is think about 2020. What Women Deliver came out with, they just put this out yesterday, it's time to redefine power. And what Florence had 200 years ago was power. What we seem to have lost in that time is bits of power which have come and gone. But if we want 2020 to work, we have to look at what power do we want. We don't want to be dictators, but what is it that we want? And use it for good at every level. Embrace the fact that in a gender-equal world, everybody wins, and that matters for midwifery. We're not all women. All women give birth. All people who give birth are women. I say that very carefully. But, it affects men and families, of course, and newborns are equally boys as girls. So, we've got to really look at what that means in a gender-equal world and strengthen our investments, our political, programmatic, and financial investments in gender equality for midwifery, because the lack of power in midwifery is about gender inequality. Make no mistake, it's about women and women who provide that care. And finally, After the very interesting discussion on what is normal birth yesterday, I think we have to use this tremendous momentum as we move towards 2020 to advance causes beyond our own. We had a discussion yesterday, is it about the midwife, is it about the woman? It's about all of it. And it's about humanity and everything else. So if we can get 2020 right, we will be in such an amazing place. If we don't get it right, we will have lost the biggest opportunity since Florence Nightingale, is my view. So, my last slide before I introduce really good speakers. How can we best collaborate to improve normal labour and birth research and really make her story in 2020? So that's my challenge to you, and if you want to come and meet me at lunchtime, we'll do some brainstorming and get cracking on it. Thank you. That's it.